The story starts off like this. So, as of, I think this was over the Christmas holiday, there was a patient receiving treatment at a Kansas hospital. Okay. And this patient is terminal. Okay. They have a diagnosis of cancer. And we know what cancer can be for those who have inoperable cancer, which is the case with this particular patient. They were diagnosed with cancer that was unable to be operated upon. So, what the patient and their family and their doctors are trying to do is obviously manage their pain for their end of life. So, while this patient was in the hospital, they decided to self medicate with some cannabis, including using a weed vape pen, a THC pen, to ease the symptoms of the cancer. Okay. That apparently, again, this patient is so far gone with their diagnosis that they have only been given weeks to live. So while this patient, cancer patient, terminal cancer patient, was in the hospital, they were vaping, okay, vaping THC with the vape. Someone from the hospital staff called the police. Someone from the hospital staff called the police on a terminally ill cancer patient who was vaping to stop the pain. And the reason that the hospital staff gave for calling the police was because, well, number one, medical use of cannabis is not legal in the state of Kansas. And the staff were apparently concerned about a fire hazard. Um, I guess. I guess. Okay. And so at first, when I said, "Oh, they called the police on a cancer patient," had to been a black person, had to been a black person. But no, I was mistaken. They on the local news interviewed this patient's son, and the son appeared to be white. Now, we are in Kansas, so they could be whitewashed indigenous people. I don't know, but I said, who calls the police on terminal cancer patients? I said, had to been a black patient, and I said it had to been. I said there ain't no way they was going to do white people like this, but yes, it appears they have exactly done white people like this. So as it was reported in the sueandproud.com, is that the police came and they described it, the outlet that is, they described this as a raid. Okay. Well, it turns out that the Hayes, Kansas Police Department themselves have wanted to refute or make clear some other aspects of the story. If you could pop up, I think that's KSN piece there, Colin. It says the police dismiss the allegations of a raid. Okay. And what they actually did was, when the police arrived, two officers apparently showed up after the hospital called the police. The hospital staff had confiscated the cannabis materials and gave them to the two officers when they arrived. The police officers in turn decided to ticket this cancer patient with some variation of possession. But before they left, one of the officers was described as feeling uncomfortable with giving this terminally ill cancer patient a ticket of which they were supposed to show up to court on January 2nd, right? Outrageous. So the police chief here wanted to sort of make the story a bit clearer, because they argue that two officers does not denote a raid. And sure, I guess usually two officers does not denote a raid. But when you have two officers coming into a hospital, entering a hospital room to what I would assume is to, at minimum, interrogate and or question someone who is laid up in the bed, terminally ill with cancer, I can see how the patient, or other patients for that matter, and the family of the terminally ill patient could interpret that as aggressive state action. The fuck are the police doing here for my relative that is laid up in the bed dying of cancer for a vape pen? So what has the final outcome of this is that the police have decided to drop the charges. They have dismissed the ticket written for the terminally ill cancer patient. And there's a couple of things out of this story that obviously bear raising. First and foremostly is, why are we still fighting the war on drugs? Why are we still fighting the war on drugs? Why is there even space for a snitch, basically, a snitch to call the police and for the police to show up pertaining to some sort of cannabis possession, right? I would love for us to get to the point in this country where literally every single place in America, if you attempted to call the police for marijuana, they would laugh and hang up on you, right? Like, I would love for us to finally get to that point where marijuana is a zero priority for law enforcement, as should be most drugs. And then we could argue, we could debate, with the rise of fentanyl and the opioid crisis, XYZ. But regardless, there are still tens of thousands of people, possibly more, languishing in prison for simple drug possession. And that should not be the case. I don't even think people should be arrested for selling drugs. Okay. People need to survive under capitalism, right? And drugs will sell, baby. Them drugs is going to sell. Ask your teenagers. They'll tell you all about it. The other part of this to me has to do with some sort of health privacy. And I understand that when you live in a place like Kansas where marijuana, still can trigger a law enforcement response, there is a space there to call the police because technically it's against the law. Okay, well, as a healthcare provider or a healthcare worker, certainly, surely you can look at the situation and assess the level of danger, not only to that particular patient, but to other patients and to even the staff. If you were concerned about the vape being a fire hazard, then maybe somebody should sit there with him while he's vaping to make sure that the temperature is not up too high on the vape, that the vape's not getting overheated, to ensure that the vape is working properly. Okay. And some people might argue, well, that's maybe not a nurse's job. Well, I think a nurse's job or a healthcare worker's job, that somebody that works in a hospital setting, is there to provide the best care that they can for the patient and to understand that the limitations of the law, that people who are at the end of life and perhaps suffering don't always have the autonomy to take the pain medication drugs that their pain dictates. That's a problem. Okay. And I need for healthcare workers to understand that first and foremostly, you have a moral obligation to your patients more so than you have a legal obligation to the system. I mean, what was the healthcare workers? What was their intention? What do you think the final outcome was going to be here? Why was you trying to get a terminally ill person, quote unquote, in trouble? To what ends? Okay. And the other aspect about this that I wanted to bring up is that normal, the National Organization for the Reformation of Marijuana Laws, for the longest time, I thought Willie Nelson ran normal. I think I've said this before. I thought Willie Nelson was normal. I thought Willie Nelson was the H white person in charge, the head white person in charge of normal. But anyway, so normal, everybody knows normal. Normal has Kansas actually as one of their states to watch in 2023 because Kansas is not up on the same level of progression when it comes to marijuana laws that other places are. Now, I was a little bit surprised by that, considering the way that Kansans voted for the abortion access to remain in place in Kansas. Again, that was part of that was a statewide referendum, and Kansans voted to make sure that abortion access remained available. So I thought Kansas was a teeny tiny bit progressive. I didn't know they were still sort of so draconian when it comes to their marijuana laws. Well, at the end of this 2022 state legislative session in Kansas, the next steps are these very slow hurdles for some sort of regulatory commission for medical marijuana seem to be going in the correct direction. But as I was watching a story from this cancer patient's son, who said very plainly that if medical marijuana was available for consumption in Kansas, then their father would not have been subjected to this police action that I'm sure was contributing to stress and anxiety, of which I would imagine is already a very, very stressful and anxious time when you know that your days on this planet are dwindling. quickly, and it hurts, right? And you would like for it to stop hurting. And the THC vape is helping with that. And then there's some snitch nurse walking around the fucking hospital that's going to call the cops on you because you don't want the pain to hurt anymore. Outrageous. There needs to be a national legalization of marijuana, period, point blank. Whatever little shit that George Biden, they all blend in together. Obama blends in there together, right with them too. Trust me, I get these wayward fucking presidents confused all the time because what is the difference, truly? But if Joe Biden was really serious about doing something regarding reforming marijuana laws, first thing he would do, which again, I know that he could do this via executive order. I don't know why Nancy Pelosi insists on lying to people and saying that Joe Biden cannot arbitrarily deschedule marijuana from a Schedule 1 narcotic, because he can. He can absolutely do that. He is in charge of the DEA. I believe the DEA is under executive purview of the executive branch, right? He can do that, but he won't. Now, why won't he? I don't know. My guess is because he's racist and trifling, among other things. But if he was serious about making sure that there was a harm reduction behind the way that these draconian marijuana laws are still in place, that they are still in force, there needs to be some sort of federal action when it comes to marijuana. It's good that there have been so many states and the District of Columbia that have decided to take things into their own hands, because the federal government is just insistent upon not only dragging their feet, but just being the opposite of a progressive government. Like, they don't want things to progress. Apparently, they would love for different variations of the war on drugs to remain in place, because America is invested in the carceral system. Okay. America wants people to be in jail. I mean, look at the numbers. The numbers indicate that we have the most people in the world behind bars in this country, which tells me that America is not invested in democracy. It's invested in jails. It is invested in jails and weapons of war and death. That's what America is invested in, not democracy, not education, not freedom. It wants people to remain in jail, and it is incumbent upon us to continue to put the press on this president, right? He thinks that moving to the middle, becoming more centrist or conservative, really, because what Joe Biden is a 1980s Republican, in my opinion. The Democrats have done a really good job of reconservatizing themselves away from any sort of meaningful progressive or leftist change in terms of their policies. And that's over. Like, we need to make sure that Joe Biden understands that this is a very serious thing. Him writing pardons for 6,500 people who are convicted federally on marijuana, like, that's cute. That's a really nice, cute start. But when the police are being called to hospital rooms to write tickets for terminally ill cancer patients, there is something fundamentally wrong with this country, with marijuana policies. And the changes need to start from the top, from the federal government, to make sure that the message is out there and that the policy is changed.